morning. Happy to have you here with us. Hopefully you all just heard or saw. This meeting is going to be recorded today. We'll have it available on our website shortly hereafter. So anybody that wasn't able to make it today, or if there's anything you want to review, you will have access to it. If closed captioning is something that is helpful for you, that is also available. Just click the live transcript / closed captioning to be able to view those captioning. So welcome. My name's Jody. I use she, her pronouns. I'm pretty new to the coalition. This is my second official general membership meeting here as staff at the coalition. So I wanted to just share a little bit more about myself with you. I'm recently coming from the King County Public Health Healthcare for the Homeless Network. So I may know some of you from that work. We may have worked closely together. You may have joined some of the meetings that I ran there. I am a nurse by training. I've been doing nursing in this area for 20 years, largely primary care within the public health and the community healthcare systems. I've also been an attendee of the coalition long before I was a staff, and I have been a guest presenter here on the agenda. So I'm hoping that we get to deepen our relationship as I am now official staff, and I'm super excited to be here. We have my colleagues here on the call. We've got Sarah Robbins, Maggie Malone, and our fearless leader, Allison. They are going to be helping to monitor the chat. I'm also going to be sharing my screen for the moment, so I have limited sight, and Sarah and Allison are going to be providing some updates for us. We here at the coalition have a long tradition of asking our beloved members to read our mission, vision, and values statement. And we have guests here today, many that have been working in this community for a long time, but are as part of our new community partner at the King County Regional Homelessness Authority. So we have Erin Bryant Thomas, who is the Director of Equity and Justice. And I'm not sure if Erin has joined yet or not, but I did see her colleagues, Shawnee Jones and Jen Ozawa here. So if I could invite you all to maybe take turns reading our mission, vision, and values statement.
Sure. Thank you so much, Jody. I'll just jump in, Shawnee, if that's okay. Good morning, everyone. I'm Jen Ozawa, she, her pronouns. I'll go ahead and read the mission. We mobilize our community to challenge systemic causes of homelessness and advocate for housing justice.
Thank you. Good morning, everyone. I'm Shawnee Jones, she, her pronouns. The vision is a region that acts on a shared sense of responsibility to ensure that everyone has a home.
Values: equity, justice, collective action. Equity, to center race in the fight for housing justice, as white supremacy and structural racism cause disparities in who experiences homelessness. Justice, to uphold the dignity and civil rights of people experiencing homelessness or housing insecurity. And collective action, to collaborate, unite, and act to build power.
Thank you to both of you. I think Erin will probably be joining us in a little bit, and all three will provide a little bit of a broader introduction as to who they are, what they're the work they're doing over at the Regional Homelessness Authority, and how we might be engaged in some of that work. So they are going to have time later on the agenda to do a little bit of a fuller hello and introduction of themselves. But thank you for that. And I'm going to go back to our agenda here just so folks as they're joining can kind of see. So we're going to talk a little bit today. We have some staff updates from the coalition here that we'll talk about. As much as I have tried to get away from talking about COVID-19 and communicable disease, I'm gonna provide some COVID-19 updates for you and just make sure you all have the latest information and where to go for more information. We have some advocacy issues that we want to keep you informed about, and some action that we may want you to be taking as part of that. We'll have our partners over at King County Regional Homelessness Authority talk a little bit, and then we'll do some member updates if there's anything you all want to share with us. So on that note, I am going to hand it over to Allison to talk about some pretty big news coming out of the coalition. So Allison, take it away.
Thank you so much, Jody, and good morning to all of you. Well, I am always grateful and really humbled to get a chance to hear the mission, vision, and values spoken by various partners and members in the community, because I think we collectively spent a lot of time thinking about how we want to present ourselves in this era. And for those of you who are newer to the coalition, you may not know that we carried out a fairly extensive collaborative process of strategic planning and nailed down our mission, vision, and values right before COVID hit. So we have had a long tradition for many years of starting our meetings in that way. And I want to thank Shani and Jen for joining us and diving right in, and let the rest of you know that we usually call for volunteers to read these shared statements at the beginning of our meetings. And that's something that the coalition was doing before I came to the coalition, and I hope will continue on. But we say these things out loud to each other to remind ourselves and ground ourselves in who we are and why we gather together. And we are really excited to be expanding the coalition staff team. We are hiring an office manager, and I wanted to just take a moment to ask all of you to help us find a passionate, smart, multi-skilled, and capable person to help keep all of our many activities on track, and make sure that we learn to do things like add music to the beginning of our meetings and post things on our website, and also, you know, pay the bills and manage our membership drive and support all kinds of activities from Project Cool to our voter registration and advocacy work. So the link for the position, thank you so much, Sarah, is in the chat, but also it's really simple. Just go to our website, homelessinfo.org, and there is a button there. I won't go into the details of what we're looking for. I will say, you know this from your own experiences, the secret is to find the best possible pool of candidates. And so we're really asking each of you to think about whom you might know, who could be qualified and interested and available, and to share this position far and wide. It's open until filled, but of course we would like somebody as soon as is feasible. So we're doing priority for applications that we receive by Wednesday, December 8th. And thank you so much for helping us to get the word out for people. So I also want to just share a few quick thoughts. Since we last met together, we had an election, and it was a big one. It was an election that is going to have some pretty significant consequences in Seattle, around King County, and in King County. We have new elected officials at the local and county and state level. And whether you voted for the people who are going to be holding office or not, we all know that we have a very clear practice of working with anyone who is in good faith, willing and able to work with us to affect the changes that we need. There were pretty significant election results, new people, in some cases, multiple new people on city councils, from Burien to Federal Way to Redmond, Bellevue, and Seattle, as well as a continuation of leadership in the King County Executive. A new member of the King County Council will be joining the council, and a new member of the Seattle City Council, and of course, a new mayor in Seattle. We are going to do as the coalition what we've always done. We reach out to introduce ourselves and to talk about our members, our work, and our priorities, and to make it really clear that we're not begging for crumbs. We are here to help secure the significant public investment in housing and other solutions for people experiencing homelessness, and to ensure that people's civil and human rights are protected and respected, and to ensure the vision that you just heard, that this is a region where people don't simply talk about wanting to do something about homelessness, but every single person, including every elected official, regardless of their political affiliation, acts on the shared responsibility to ensure that everyone has a home. So it is an exciting time, and it's a lot of work. And all of you are going to be joining us in communicating with our elected officials, introducing yourselves as constituents, and making sure that we've got a good quality of conversation. Sometimes elections are about rhetoric that doesn't always advance the solutions that we need. So we need to continue to do our work with a positive approach, and be prepared to defend what we have already secured and complete the work. So we're really excited. We're looking forward to inviting you all to join us as we meet with some of our new elected officials. And you could do that in a variety of ways. So we will be keeping you up to date. If you're not already signed up for our emails, probably you are, please make sure that you do go to our website, homelessinfo.org, and sign up for our emails. We're going to be doing some email transformation over the next 2 months. So for service providers, advocates, people who themselves have personal experience of homelessness, people who come to our membership meetings and participate in our activities, we are creating this homeless services and housing network email list, and we're trying to really streamline the communications. So hope that you will respond when we give you a little email prompt about that. Just a little reminder that voting matters. Right now, King County Elections is saying that voter turnout was a little over 40%, which sadly is, relatively speaking, good, but is really not that great. So I want to just take a moment to thank everyone who helped someone else register to vote and or vote during this most recent general election. And in particular, I want to thank our partner and member organizations in the community who hosted our staff and volunteers, and give a shout out to Jody and to Maggie, who plunged in and coordinated our voter registration volunteers and worked with our sites and did a whole lot of remarkable short notice running around to ensure that people understand how to exercise their voting rights. I really have to say our work on this during COVID has shifted dramatically, and we are learning as we go. We're really, really excited to deepen some of the partnerships that we have, and we are extremely excited for January 1st, 2022. Just a quick show of hands. Do you know what happens on January 1st, 2022? Just raise your hands if you know what happens on on that date for our community. 26,000 people in Washington State will have their voting rights automatically restored. That is part of the result of our advocacy in partnership with directly affected people who have been part of the criminal legal system and who led a multi-year effort to transform the voting rights laws in this state and are working really hard to implement the changes. We are proud to be part of the Washington Voting Rights Restoration Coalition that fought for and won this new legislation, and that is continuing to fight to ensure actually full restoration of voting rights, including for people while they are incarcerated. That will probably take several more years, let's be honest. But right now we have an incredible opportunity to make sure that people know this. You have probably had the experience that you've talked to people about voting and you've heard people say, I can't vote, I'm not eligible, I have a felony. Well, it is on us to make sure that people know that very shortly that is not going to be true. So we are really happy to share, and I'll ask if staff can, while I'm talking, just find the link in our little Google document and drop it in there. We're really happy to share a call for art. The folks who are at the Washington Voting Rights Restoration Coalition are a wonderfully creative bunch, and we have committed to getting the word out. There's a call for art, any kind of visual images, as well as poetry, short poems, 50 words or less, because this is going to go onto posters and social media that's going to be shared statewide. And we would love to invite you to get the word out. Priority is to people who have been personally affected by the criminal legal system. And there's also a specific category for friends and family. There are some prompts to respond to, and the call for artists is really for Washington residents. Folks who are interested in participating, you should know the deadline is November 30th. So it's coming up. And I want to challenge you, invite you to think about, if you are providing direct services, you work in housing, shelter, or another service setting, is there a way that you can get the word out about this opportunity to the people whom you're working with, and really ensure that we've got some firsthand messengers? We're working on the Credible Messengers plan to continue to get this word out, and I think I will leave it there, but it is always a joy to think and talk about the expansion of democracy to include all of our neighbors. And I don't have to tell folks on this call today why that is such a source of positive and hopeful joy. So, and also we would love to see your poems. So I will just say we're thinking about a poetry slam in our collective future. So the call for art is there, and I think just the last thing I'm going to quickly say is please mark your calendars for December 16th. We have our meeting every third Thursday of the month. We will talk to our friends at the King County Regional Homelessness Authority, whose meeting got dropped on top of ours, because that is no good. We've been meeting on the third Thursday of the month for decades now. So we're hoping not to put people in that point of having to choose. But December 16th is going to be an especially important and wonderful meeting. The registration's already live. Thank you so much, Sarah. We're extending it, as those of you who've been at coalition meetings before may know. We use our December meeting to get ready for the 2022 legislative session that starts early January. If you're new to Washington State, you might not know this, but we do something fairly wacky. We have short legislative sessions in even years. That means the legislature has 60 days, 2 months, that's it. Our long legislative sessions are not that much longer, they're 105 days, but 60 days is not a lot of time. So we need to be prepared as advocates to hit the ground running, which is why we start in December. And we will be bringing you really lawmakers who will share their priorities, be available to field questions from you. We'll also be helping make sure that you know who represents you in Olympia. So we'll help you look up who your state senator and who your 2 state representatives are and how you can communicate with them. It's likely to be a mostly virtual session again. The bad news is that means we won't go to Olympia together in a bus and wake up way too early and rally on the steps. The good news is that you can think creatively about ways that you're going to engage the folks whom you work with to participate remotely, it is a little easier to give testimony and to weigh in on legislation remotely. So we will be sharing all of that with you on December 16th. And we actually are going to ask you to help us plan for how we're going to keep you informed in this fast moving session. We've got some ideas and we'd like to test them out with you. And then we'll also probably do a little map to remind ourselves and our lawmakers just how broad the Seattle-King County Coalition on Homelessness membership is. In past years, we've been able to demonstrate that we have members who live in every single one of the legislative districts in King County. And frankly, our membership extends because a lot of folks can't live in King County. And so we've got a multi-county membership, and we like to flex that when we talk with elected officials. Okay. I think that is all that I'm going to say by way of introduction. I'm going to turn things over to Sarah. We're going to talk a little bit about legislative advocacy and other kinds of advocacy that we're engaged in the Seattle budget process, in King County. I'm going to give you a really exciting health through housing update, and at the state level with DSHS. Sarah Robbins, as many of you know, is a very experienced public benefits attorney and a fantastic advocate who just at the drop of the hat testified at the Senate Human Services Committee on less than 1 day's notice, and is going to talk with all of you about the DSHS advocacy that we're doing that we want to involve you in. Sarah.
Great. Hi, everybody. So the coalition has been working with a group of member organizations, direct service providers, advocates about DSHS offices being closed. So I'm sure most of you know that DSHS offices closed in March of 2020, along with, other state government offices due to the pandemic. And unfortunately, so in May of 2021, as state offices were getting prepared to reopen, as the governor gave the direction that offices could start to reopen, DSHS sent out a notice that they were not planning on reopening offices in the way that they were open pre-pandemic. It was going to be a very limited reopening where people could make appointments for very limited services, and walk-in was going to be limited only to getting an EBT card and some other limited services around bus passes and transportation. We wrote a letter and asked for a meeting with the head of the Community Service Division at DSHS, expressing our deep concern that many clients, especially those living unhoused, have not been able to access benefits during the pandemic, both applying for benefits and renewing and recertifying their benefits. Along with the offices not being open, with the shift with everything to the call center, clients and advocates have found that the call center is almost impossible to access if you don't have unlimited minutes on your cell phone and the ability to charge your phone at will. Wait times can be up to 3 hours. We regularly hear that people are waiting for an hour or 2 hours and then get disconnected. It's become a very difficult phone center to reach. So over these last months, we've been meeting with DSHS on a regular basis, proposing, making proposals on how we believe that the office should be accessible, which really is, if someone feels the need that they need in-person assistance at DSHS to access entitlement safety net benefits, they should be able to walk into an office and get assistance from DSHS staff. Or they should be able to call the call center on a phone that has limited minutes or limited charge. Unfortunately, we found out recently that DSHS does not, the offices have reopened in a very limited capacity on November 15th, so just a couple days, but the access is very, very limited. You can only walk in essentially to get an EBT card or a bus pass. Otherwise, there is a navigator in the office that will direct people to a phone or a computer in the office. So we have a sign-on letter for organizations that is going to be directed to the Secretary of DSHS, the Director of the Office of Equity, the Governor's Office, and the Assistant Attorney General who represents DSHS at the AG's office. Essentially asking for to come up with a solution on how DSHS can open their services to make them accessible to everyone, both living unhoused, people with disabilities. We also believe this really is an accommodations issue. There are many people that need in-person assistance and need, additional help through the process. So there's a sign-on letter for organizations. I will drop that link into the chat if your organization is able to sign on. And then, as Allison said, we were invited to speak at a work session of the Senate Human Services Reentry and Rehabilitation Committee this week to talk about it. So I think we also have the attention of some representatives and senators that work on these issues to strengthen these programs. But strengthening these programs doesn't do much if people can't actually access the programs. So happy to answer questions about this either in the chat or feel free to email me. I'll drop my email in the chat as well.
Maybe it would be good to just hear if anybody has any quick questions now. Oh, there we go. Okay, I made a bit.ly a shorter link, so both of these links will work. Yeah. Okay, well, if you have any questions, as Sarah said, please do ask us. And also, I want to underscore that, of course, we want to make sure that we've collected stories of what this has meant for the folks whom you work with. It's been one of the key things, frankly, that I have used to explain to people what it means to abandon thousands and thousands of folks during a global pandemic, is to say, did you know that the DSHS offices are closed to the public and have been since March of 2020? And people start to get an inkling of what that might look like. So thank you so much, Sarah. I have to apologize to my colleagues. I kind of took a wrong turn on our agenda here. So I'm just going to quickly talk a little bit about the City of Seattle budget advocacy and King County Health Through Housing implementation. As you all know, by tradition, the City Council and the County Council take final votes on the budgets that they have adapted based on the executive's proposed budgets on the Monday of the week that includes Thanksgiving. So that is this coming Monday, meaning we have only a few more days to ensure that a cost of living inflation adjustment for city human services contracts is included in the final budget. I want to give huge props to Council Budget Chair, Councilmember Teresa Mosqueda, and Councilmember Lisa Herbold and Councilmember Dan Strauss for sponsoring the additional inflation adjustment. I think many of you have taken action, and we want to encourage you to email City Council members if you are a Seattle resident, again, to thank them for this addition into the current proposed budget and to ensure that it stays in. Lots of things can happen between now and Monday. I will say we are doing some work related to the HOPE team, which is the successor to the NAV team, which we have been working to ensure does not harm people experiencing homelessness and doesn't spend millions and millions of city dollars to move people around in violation of the CDC guidance, by the way, and not actually improve people's health or safety. So you may be hearing an emergency call to action from us about that. There's a lot of stuff happening behind the scenes. I want to also acknowledge the extraordinary work that the Solidarity Budget folks have been engaged in. Primarily, the Solidarity Budget came together around true public safety and accountability for the Seattle Police Department. There are a number of aspects of the Solidarity Budget that we've been able to contribute information and knowledge to. And I'm going to drop in the chat here a link to take a minute to take some talking points and offer input in support of the Solidarity Budget. Right now, one of the things that's going on that I think may be a reason why we have some fewer folks here today is that right now is a City Council public budget hearing. It's the last public budget hearing, and folks are waiting virtually online to give public comment, which is fantastic, and we support it. There will also be a short opportunity to give public comment verbally tomorrow morning. And we'll post that information on Facebook and on Twitter for people. But the reality is you can give public comment anytime by calling or emailing your Seattle City Council members. Remember, if you live in Seattle, you have 2 citywide council members, Councilmembers Gonzalez and Mosqueda, and then 1 council member for the district in which you live. And we want to acknowledge there's a lot that can't be addressed in the budget. So we have a lot of additional work that is still going to happen, and we will probably try to invite a couple of council members to give us a bit of an update at our December meeting, because there's going to be a lot of movement between now and Monday, and then a lot between Monday and our December 16th meeting. So please feel free to put any questions in the chat, or if you have a particular interest, and Harold, I'm looking at you, if you have a particular interest in the issues related to the actions of the HOPE team and the effect on people who are unsheltered of city policy, please reach out and let me know, and we will fill you in as best we can on what we hope will be an opportunity to bring some reason and rationality to that body of work. Now, on to the King County Health Through Housing program. I will just also pause to say, unbelievable. We are so close to having the implementation plan approved. And just as a little reminder, this is the single largest scaling up of permanent supportive housing in our community ever. 1,600 units of permanent supportive housing that will include not only money for the buildings, but money for operating those buildings and for staffing those buildings, including on-site behavioral health services. That is what we need more of. And we have all worked so incredibly hard in a very short amount of time. To me, this is the ultimate example of taking the crisis of the global health pandemic and making opportunity out of it. We knew that we had the authority in King County to pass a 1/10 of 1 cent sales tax and to dedicate that to housing for people at the lowest incomes. but council was not acting on it. There wasn't the political or public interest in doing it. But in the pandemic, 2 summers ago, hard to believe that, we got a call from the King County Executive's office saying, we want to do a thing. And we said, yes, we are all in. So you all know, we are thrilled to say there are already 2 health through housing buildings that are open and housing people, thanks to Catholic Community Services and to DESC. There are already over 150 people who have homes in the 2 first buildings to open. There are processes underway to not only open a total of 1,600 places for people to call home, but to do this truly regionally. There are conversations, and we will be calling on you, have no fear, to ensure that buildings open as quickly as possible and in good accordance with local communities in Federal Way, in Auburn, in North and East King County. This is not something that we've had the opportunity to do before, and it really, truly is something that we can celebrate and be proud of. It's not quite over, but the King County Regional Policy Committee took a vote last Wednesday, and the King County Council took a vote yesterday that was described to me by a King County staff person as the shortest, most unanimous, rapid action to create housing that I've ever seen in my entire career. And that is a testament to the 150 or so folks who have sent emails to members of the Regional Policy Committee and the King County Council so far, and made it really clear that despite some loud voices of opposition of people who I think will really never be happy, we have got another conversation going on. So we're really excited. The final King County Council vote, we believe, will be Tuesday, November 29th, no, November 30th. And we hope to be able to invite you all to send messages of thanks, to have passed the implementation plan so that we're not slicing and dicing, so that we're saying capital operating services, wraparound on-site care is what people need, is what people deserve, and is what works, and is what should be funded. So that is the end of my little too long soliloquy. I hope I haven't forgotten something. I'm gonna go on mute and turn things back to Jody. And I'm sorry, Jody, to ask you to talk about COVID yet again, but I know that you will translate well for all of us. And please feel free to put any chats or comments about the city, county, or state advocacy Sarah and I just talked about in the chat. Bye.
Yes, thank you, Allison. I think according to my agenda, we got it all covered, and we're actually doing really well on time. So don't hesitate to throw a hand up, throw something in the chat if something is piquing your interest, or you need more information on something, or you have something to share. So I am still your trusted, credible, and licensed public health nurse, just because I'm not in public health anymore. And I want to start, this is like, this actually almost makes me want to cry, although it's been an emotional week in general for me, but it has been a long time since I've been able to say something kind of positive around COVID. And I want to say that as of yesterday, that I noticed, it could have happened a couple days ago, King County went from very high community transmission, which is the highest level that public health is tracking community transmission, and we dropped down to substantial. So the county basically tracks community transmission at either low, moderate, substantial, or high. We have been at high for months because of Delta. So this was that kind of gut punch that we all got in the summer, that we're all, I think, still reeling from in a lot of ways. But this is not small. This is something to smile about. This is something to, provide a little spark of hope, of energy, light at the end of the tunnel, whatever you might need it to be. It's not small. This number is based on the number of cases per 100,000 King County residents per week. So if we have more than 100 cases per 100,000 residents in a week, we're at that high level of transmission. Based on the last 7 days, we were at like just under 89 cases. So really, really positive news. This really warmed my public health heart, and it's been a little bit like, you know, kind of a little ice stone lately. So doesn't mean we're getting rid of masks. Doesn't mean we're getting rid of, you know, some of that social distancing. Doesn't mean we're not going to still really talk about the benefits of vaccines, especially because, you know, not new news at this point, but Pfizer has a vaccine for the young folks in our life, right? Those 5 to 11-year-old kiddos can now access a safe and effective vaccine. This is a little bit of a slow trickle, you know, with supply getting out to places. King County Public Health is really only doing it by appointment at their clinic, their vaccine clinic sponsored sites. Seattle Public Schools has a whole calendar, and we'll throw those resources and those links in. But it's out in a lot of pediatric doctors' offices. It's out at King County Public Health sites. It is in pharmacies. Like I said, Seattle Public School has partnered with King County Public Health around this as well. So lots of places and options for the young kiddos in your life to get access to vaccine. The other thing that we wanted to kind of talk about was boosters, and just a quick and dirty update around boosters, and hopefully provide this information to you all. So King County Public Health and Healthcare for the Homeless Network have been having a weekly homeless service provider meeting. It is now switched to every other week. It is a great place to get a lot of these updates and information. But here at the coalition, you know, part of what we like to try to do is really hear what information you need, elevate your voices around what you're seeing and what's happening. And, you know, I am still the person that you can come to if you've got questions about boosters. If you have clarifications, if you're not sure something, I'm still someone that can possibly answer that question directly and easily, but I can also take that burden off of you in helping find that information and then sharing it with our community. So boosters is the concept that, and this is true of many vaccines, not just of COVID, but boosters is something where over time, our immunity can kind of start to drop off a little bit. And what we're seeing with our COVID vaccines is that we're still seeing really, really good protection against severe illness, hospitalization, and death. But over time, we're starting to see an increase and a little less protection around mild or moderate illness. And the boosters are really there to bring that immunity back up to that highest level that we can expect to see. We are still tracking what time and these vaccines are doing around transmission amongst vaccinated folks. So that is also something that is going to continue to be something we watch. But if you are someone, or your clients or your colleagues are someone that got the J&J vaccine, anybody 18 and over who got the J&J vaccine, and it's been at least 2 months since that's the single dose again, they are eligible to get a booster of any vaccine. CDC is saying you can mix and match. And we were not saying that earlier on. You know, a year or so ago or whatever, we were saying, no, you got to stick to that one, that same one. That is not the case anymore. So if someone is 18 and 2 months past their J&J dose, they are eligible for a booster. That's it. It's really just the time from vaccine and age. If you're someone that received either the Pfizer or the Moderna, that's the mRNA vaccine, there's a few more eligibility requirements around that booster. So you need to be 6 months out from that second dose. And then they're saying, if you're older than 65 and you're 6 months out, great. We recommend you get that booster because we want to see that protection come back up for those folks. We know that those were some of the highest demographic of folks that really had a lot of morbidity and mortality or illness and death. If you're 18 to 64 and you live in a long-term care facility, if you have underlying conditions, and there is a list, but it's quite a long list, history of smoking, you know, you're immunocompromised, like say cancer, higher BMI. So there's a number of things, heart disease, lung disease that are underlying conditions for you, you qualify. Or if you're someone that lives or works in a high-risk setting, and homeless service sites are considered a higher risk setting because of their congregate nature and how many folks are coming and going. I qualify for a booster on a number of fronts, actually. So I did this. A lot of the places, it's just a self-reporting that you are eligible and you qualify. And I just want to kind of throw out there too that throughout this pandemic, the CDC and even the State Department of Health has often used a homeless shelter, and they use that specific language. We have always clarified and have always gotten verification that that is a homeless service site. So if you're a case manager working out in the field, if you're in permanent supportive housing, if you're in a day center, you know, across the board, you might see the word shelter, but if you are working in another, you know, hygiene facility, anything like that, you qualify. You qualify. So we want to make sure that you, your folks, your colleagues, your clients all know that as long as you're at the, you know, the right age and the right time length out from your last dose, you qualify for a booster, and you can help bring your immunity back up. I think that was mostly what I wanted to talk about with COVID and boosters. I don't think I'm forgetting anything, but maybe one of my colleagues. Yeah.
No, I don't think you're forgetting anything. I think that we have a question from Phoebe. Phoebe, if you would like to unmute yourself and ask your question, feel free to do so. Otherwise, I can read your question.
Sure, thank you. Hi, I was just curious about if we know how the vaccines impact sort of like longer term symptoms or slow COVID, if there's any data that's been released on that. Can you
maybe give me one or two more sentences about what you mean by slowing COVID or protecting against symptoms, just so I can make sure I'm answering it correctly?
Yeah, and I will also just clarify that this question comes from seeing things like online of people talking about it. So understanding that, you know, there's so much information out there that may or may not be true, but I've seen people talk about how they've developed longer term disabilities or symptoms that are neurological or disability creating for them. And I'm curious if the vaccines have been shown to slow any of those impacts or prevent those impacts.
Gotcha. Great question. So I think part of this is something that we are still learning about and will continue to learn about. But that idea of long COVID, which I think is what you're asking about, or long haulers COVID, it is a long-term effect of COVID for a small percentage of people. It's not common, but there are a number of people who, you know, sort of recover from their initial illness with COVID, and they're no longer symptomatic, and maybe all or most of their symptoms have resolved, but they continue to have some longer term effects, and it can be neurological. They've seen some psychiatric things. They've had longer term underlying lung issues or permanent lung damage that can affect folks in the long term. And that is something that we are still learning about and understanding. They're doing a ton of research with it currently, actually. They've got some COVID clinics in other parts of the country where they're starting to see what are the treatments that can help people recover from that long COVID. One of the other things about vaccines that we are still learning about, and that I kind of talked about it briefly before, is the way a lot of vaccines work is that it not only protects the person from getting infected or having severe illness from it, but it also helps protect me as the vaccinated person from giving it to Allison, right? If I did end up getting infected, right? That's something we're still learning about with COVID. And that's one of the things where the boosters and the Delta variant have become a really key piece of this information, and why we're promoting boosters is because the Delta variant seems to be a little more highly infectious and a little bit easier to transfer to the next person. And so we're wanting to bring everybody's immunity back up to the highest level that we can get. But that's research that's still underway that we're trying to learn about long-term with that. What I will say that I think is kind of embedded in your question, or at least worth raising up, if not exactly, is we know that folks can be infected with COVID. They can be passing it to other folks unknowingly because they don't have any symptoms, right? That's that term asymptomatic that might get thrown around in other, in articles or media. Asymptomatic just means you don't have any symptoms, or it could be so mild that you don't really recognize yourself as being sick or as being something other than maybe your baseline allergies or your, typical headaches or something. So that's why, again, we want to be getting all those really vulnerable folks and folks that have a lot of higher exposures potentially vaccinated and bring that immunity back up. Did that answer your question, Phoebe?
Yes, thank you so much. I appreciate
Wonderful.
Well, thank you so much for asking it, Phoebe, and thank you for your careful and thoughtful and thorough answers, Jody. I will say, I think it's really wonderful opportunity for all of us to have our very own public health nurse. And Shauna put in the chat that, in early days, she and some others needed to sort of provide documentation to back up homeless service providers as essential workers. If you run into any issues like that, let us know. We've done a ton of advocacy around this. I don't think it will be necessary, but let us know. I just put a link in the chat to something that I have found to be a really accessible, good source of information, which is a blog from our public health department called the Public Health Insider. And they've done a really great job, I think, of focusing, first of all, on real people and raising up people of color who are asking and answering questions related to COVID and vaccines and many other issues. And it's a really timely and useful source of information for yourself and for folks whom you may be working with. So you can sign up to get it in your email, or you can just check the blog. And their current thing is just about, if you're traveling over holidays, do you need to get tested, and some good information there.
Thank you, Allison. And yeah, thank you, Shauna. And again, I just want to end on, unless there's more questions, but I just want to end on the fact that, like, we understand that you all are incredibly busy and doing a lot of truly essential work. And because of the nature of science and because of the nature of it being a new virus and disease, it feels like, if it feels like, the ground underneath you is constantly moving, it's because it is, right? Like, as we learn more, we update our information, and then that changes how we approach things. We are here to help track that for you. Our public health department is actually pretty impressive around that stuff and getting that information out. Their website's pretty accessible, but if it's easier to just come to us, let us do that for you. And I'll drop my email into the chat just so you all have it. Because if I don't have the answer or I can't answer it, I do have an inside scoop to the Healthcare for the Homeless and the public health folks over there. So I think we are doing amazing on time. We are now going to pass it over to our colleagues at the King County Regional Homelessness Authority. We have Aaron Bryant Thomas, who's the Director of Equity and Justice, her colleagues, Shawnee Jones and Jen Ozawa. So I am going to hand it to the three of them to give you a little bit more about who they are, what they do, and the work that they're hoping to share with us. So the floor is yours. Thank you.
Good morning, everyone. I just want to say I am really enjoying this space. This is a very empowering meeting, and I just feel honored to be in this space. So thank you for allowing me to be here today. So for those that missed my introduction in the beginning, my name is Shawnee Jones. I am the procurement coordinator at the King County Regional Homelessness Authority. I'm about a little over a month in this position. And really, so my role at the Regional Homelessness Authority, let me back up. Really, KCRHA as an organization is committed to doing business differently, right? We have made some pretty public stances on we will be different. We will not be doing business as usual. And part of that is my role in as a procurement coordinator to establish and implement an equitable procurement process. And what that really means, at least for me, what that really means is really centering people, centering those that are experiencing homelessness, right? Ensuring that those folks are at the center of all decisions, that their voices are at the table, but more importantly, that they are at the table. It's not a situation where we plan to just come up with this process or make decisions internally. We really want community. We really want folks with lived experience to partner with us. You know, we want their voices. We want to listen to them. We want to partner with them. We want to establish relationships, right? It's one thing to engage, but there's it's engagement to me is different than building relationships, right? I want to build sustainable relationships. So we're not just tapping into folks and overwhelming folks when we have an ask, when we need you, right? And draining you of all your knowledge and resources, but not implementing those recommendations, not implementing your suggestions, and then not circling back with folks, right? So we do have an RFP that's coming up, and this is kind of like the groundwork that we're doing now is like reaching out to our community partners and stakeholders. And yeah, I think that's my little spiel for the morning. And so in part of that work, Jen Osawa was hired on as our consultant to help us kick off our procurement process. So I'm going to kick it over to Jen to see if she has anything else she wants to add.
Shawnee, before I jump in, I just have to say, Jody, Dr. Fauci better watch out because thank you so much for your wealth of knowledge. That's the best COVID information I've received in a while. So thank you for sharing all of your experience and insights about COVID. But anyway, Jen Ozawa, she, her, so she, her pronouns. So I was hired as a consultant. I'm the owner of On Point Consulting. And just started partnering with Shawnee and Aaron and other colleagues at KCRHA. As you all know, it's a new entity that's starting up. Unfortunately, there are also, priorities and work that has to get kicked off. And one of those things that happened kind of pretty quickly for the group is the upcoming RFP that Shawnee mentioned. That's why I was hired, is to essentially help build some capacity while the rest of the organization works on its infrastructure and its systems and its policies. So Shawnee and I are really excited to kind of begin the equitable procurement process through the upcoming RFP related to non-congregate shelter. So there's still, I'll be honest, just completely transparent. There's still a lot of logistics that we're figuring out as far as budget amounts, kind of what restrictions are in place and what flexibility we have together collectively to to define and see how this funding will kind of shape out and end up going out to the community for a competitive process. But we're here today, and thank you to the coalition for allowing space for us, and look forward to continuing to develop relationships here in this group. But we wanted to invite folks, also acknowledging everybody's extremely busy and it's been a rough couple of years. But if time permits, we do have 2 opportunities to help share your insights and your wisdom and give feedback on sort of what you would like to see non-congregate shelter in the city of Seattle look like with these new funds. So they are new, they're not existing, they're not being repurposed, they're brand new, it's a brand new fund source. And we do have some flexibility to define, what non-congregate shelter should look like. It could be anything from tiny house village type programming to hotels to something even more innovative kind of within that shelter, within the shelter parameters. So we have 2 opportunities. I'm going to drop a Eventbrite link in the chat. We are going to host a conversation or a listening session on November 30th from noon to 1:30. It will be virtual. I know that's a long time, but if you're able to pop in like on your lunch break or, you can't stay the whole time, that's completely fine. Any involvement you're able to provide, we absolutely welcome and want this to sort of be the beginning to hopefully many other collaborations together. So
Jen, you just went on mute actually, so we missed the last maybe sentence or 2 or 3.
Okay, sorry about that. Thank you. So I just put the Eventbrite link in the chat. So if you're able to join us, if you have interest in joining the conversation on the 30th, you can register there. And then if that's not doable, I ask that you share your email if that's okay, maybe in the chat, and then we will follow up with a survey and an opportunity to give your feedback and give your insights that way. So again, thank you so much. If we're trying to get as many folks as possible to give their input, and then the coalition has also offered the opportunity for us to loop back probably in January or so once the RFP is fleshed out, after we do a lot more engagement with folks over the next, unfortunately, just couple weeks, because this is a really, really quick turnaround. But we want to loop back and kind of give an update to kind of how things were shaped. We also are seeking raters, so if you have any interest in being at the table and making some decisions on who is funded and who, based on who applies, we're also seeking some volunteers for that as well. And then I will pass it over to Erin to talk more about kind of her role and her work at the RHA.
Thank you, Jen. Yeah, thank you so much, Jen. Good morning, everybody. My name is Erin Bryant Thomas. I serve as the Director of Equity and Justice with the King County Regional Homelessness Authority, and my pronouns are she and her. And I am off camera today because I have bad signal. And so I hope that's okay, but you get a chance to see a little bit of who I am. And so I'm a wife and a mother of 3 boys. And I just bring that in this space because these children will one day be adults, and one day be adults who may be providing services or utilizing services. And so that's something that I keep in mind really at all times. And I appreciate the work that you all do in making sure that we constantly find ways to do things better for the people we serve. In my role as the Director of Equity and Justice, there's so much, right? There's so much that role is responsible for doing. But I feel strongly that we all have a huge responsibility around really undoing what's been done. And so that's a message that I share everywhere I go. That the construct of race and the construct of racism and how it all lives out is something that we constantly have to resist and work against and recreate something different that is going to really have an effective impact on our our society and world as a whole. But I'll just speak really tightly about what I'm working on right now. And really, Shani already spoke to it in her introduction, just around making sure that we are working in collaboration and partnership and really making that real. And we are doing that through a framework that's called the equity-based decision-making framework. What I'll do in a second before we get off is just put a quick link in the chat. This framework was developed in partnership with the National Innovation Service, so our CEO, Mark Dones, and some of their colleagues, along with community and community input, and really to address the regional homelessness authorities, just way of being, right? Really helping us as staff to really foundationally understand how we're going to move and operate as we do our work. And so that's through policy and decision making and strategies, through our business operations and through our hiring operations. But not only those three, also through our procurement, which is what Shani talked about. And so I look forward to maybe one day coming to this space and really just delving deep into the framework, really sharing more about what it is and how we plan to utilize it so that we can make our theory of change real. And our theory of change is simply, if we create a customer-centered homeless response system, then we will be able to meet needs and eliminate inequities in order to end homelessness for all. And so I look forward to maybe coming back. It may not be right now, because right now our priority in this conversation, in this particular situation, is the RFP. So we're hoping that folks can, find some additional energy to assist us in this effort. But we would love to come back and delve deeper into the equity-based decision-making framework and really partner on how we do our work differently and better. I hope that's helpful. I am on the same page with Shani and Jen. It's just a pleasure to be here. We all have a background working with the city of Seattle. I was there for 7 years, 7 months. Shani how long were you there, Shani?
About 13 years.
13 years. Jen, how about you?
I was there off and on for probably about 7 years or so, maybe 6 or 7, yeah.
Yeah, so that's collectively almost 30 years, right? And so I'm grateful for all the people that's been a part of this work. Yesterday, we got an opportunity to talk with Sarah, Allison, and Jody, and to hear the history. This particular group has been around since the 70s. That's powerful. And I'm just so, and Nancy, I see you nodding your head over there. I'm grateful to be in space with the body of folks that's been organizing for such a long time. That means you've been organizing with principles, things that keep you grounded. And the way that this homelessness system, all the things that change, the priorities change, budget and funding changes, people, move on and leave and all of those things. But to be able to sustain a movement like this, I have to commend you. And then I also have to extend my gratitude for opening it up to us. And so just so grateful. We look forward to continuing to partner with other folks. If you have other recommendations, please let us know. We are in conversation and partnership with the Lived Experience Coalition. And I think that being here with Skitch is just going to enhance the work that we're striving to do. So we so appreciate you. Thank you.
Thank you to the three of you for being here, giving us a little bit of an introduction and thinking through how we might get to work together ongoing for that transformative change. We have a few minutes, so I don't know if folks have questions or comments or thoughts around anything. Allison, I thought I saw your hand go up and go down, so I don't know if you wanted to jump in here, but I'm just going to open the floor.
So I do just want to say real quick, the Evite, if folks are trying to, and I haven't seen the chat, the event is from noon to 1:30 on the 30th of November. So just want to clarify that. I'm working on adjusting that right now. And apologies.
And Jen and Shawnee, we can also send that out in our next communication. There's obviously not a huge amount of time between now and then, but we'll happily try to push that information out. I want to thank all three of you so much. It's really, we all understand it is hard to make change happen inside of bureaucracies, and to try to build something that kind of has to be a bureaucracy, but that is different, is also very hard. So we're really grateful to each of you, and your presence here is always welcome. And we really, I want to underscore something that I think many people don't necessarily think about, but it's the fact that a lot of direct service providers themselves have personal experience, whether it's of homelessness, of living in poverty, of experiencing systemic racism in their lives, of having had contact with the criminal legal system, having experience of substance use disorder. There's a lot that frontline staff have to share about their own experiences as well as their professional experiences. And that's one of the things that I think makes this organization powerful, is that we don't necessarily bifurcate. We want people to bring their personal and professional knowledge and experience to bear, because that's what makes powerful advocacy. And it's also what makes for good service provision, provided, you know, we have the right supports and we're paying people what they need to live. So I want to also just mention that the RFP that is underway, that Shawnee and Jen are asking people to contribute knowledge to, is also an opportunity to share what you've experienced or observed about what has been effective in non-congregate sheltering. We recognize and understand there are still congregate shelters in our community, and we want to support those to be as good as possible and as healthy as possible for the folks who live and stay in them. And we have been pretty solid, and so have some of our member organizations, I think most prominently and publicly DESC, in saying we're not going back. It was not appropriate. It was not good to put 50, 80, 100 people on mats on the floor starting at 9 o'clock at night and tell them that they've got to be up and out by 5:45 a.m. That's what a fair number of shelters looked like. And COVID transformed overnight only shelters in our community to have to be 24/7. That is a really positive thing if we sustain it, and if we also don't lose capacity. So we really want to encourage folks to think about joining the conversation, even if you've never really participated in giving input like this before, because Jen and Shawnee have made it really clear they want to hear what's been positive, what's not worked, and that's their job, is to take that experience and knowledge and transform it into what they're going to put out for a funding opportunity. So please don't hesitate to share what your firsthand experience and knowledge has been, or to invite others to do so, because I think that's a really powerful way to get things looking different in the process and the outcome.
Wonderful. Thank you, Allison. Yeah, so I just want to again open it up and make sure that there's not anybody here that might have a question or follow-up comment for Jen, Shawnee, or Aaron, because this is a wonderful opportunity where we have all three of them, especially heading into a tight turnaround around some of the work they're trying to get done. Okay, well, we still have just a little over 10 minutes left in our meeting. So if something is percolating or you're trying to find the unmute, or need a little more caffeine to get that comment or thought pulled together, you have time for that. And as always, we are here to pass messages along, and I might just invite Jen, Shawnee, and Aaron to let us know the best way folks can reach out to you all around this. But yeah, are there any member organization updates, highlights, things that you all want to share from what's happening in your world? Let us know how things are going.
While folks are thinking, I'll just say we'll throw our emails in the chat as well in case you want to follow up after the meeting. Happy to answer any questions that might come to mind.
Great, thank you, Jen. Well, all right. I might just turn it back to Allison just to maybe give a little bit more of a, oh, we've got Nicholas. I see your hand. Please take the floor.
Good morning, everyone. My name is Nicholas. I'm a case manager with the Housing and Essential Needs Program at King County. My question that I wanted to present was frequently when we conduct intake appointments for individuals to enroll in our program, all too often inquiries about motel, hotel vouchers, where they can be obtained, if they exist, if they're like a unicorn. If anyone has any insight as to that question, I would be immensely grateful. Thank you.
Nicholas, thank you for asking that question. Let me just make sure that I understand. Well, I'm actually very curious whether you can, some people may not know about the Housing and Essential Needs Program, but it seems significant to me. You are working in a program where one of the benefits that you can offer to people is help with paying rent, and people are asking you about motel vouchers. Is that accurate?
Yes, I apologize for not giving more
That's okay.
Comprehensive insight. Yes, our program provides ongoing rental assistance for individuals who are experiencing a short-term or long-term incapacity. And a lot of times individuals that I conduct an intake with are currently unhoused and are seeking that temporary bridge to find housing stability. And that's probably the biggest challenge is we don't, have direct, properties, rooms waiting for new intake, new enrollees in our program. Mm-hmm. And we are really kind of stuck in a lurch into saying, yes, you're enrolled in our program. Unfortunately, you're going to be in the same housing circumstance. So I hope that provided a overview.
Thank you. Thank you so much, Nicholas.
Oh,
and
you're very welcome.
Yes, and I don't want to put you on the spot, but I will say, look in the chat, because there's a really lovely message from Karina, who's here, and thank you. I don't want to preview the legislative session to come, but Sarah, maybe it will be possible to talk a little bit about the Housing and Essential Needs Program and how we might try to begin to reform that effort. But Nicholas, I perceive that what you're saying is a painful version of the truth that we are sitting with, which is people need housing. And even a program like the Housing and Essential Needs Program still means that people have to find a place where they can stay that will accept that rent assistance. And who wouldn't want a motel voucher, hotel voucher, or something that is like, here is the place, here is the door that has a key that we can hand to you, even if it's only a certain amount of time. I think, and I want to leave space here for Sarah to jump in with her take on this, but I think particularly in Seattle and for people who are without homes, there has been a strange effect of the city's desire to look like they are doing things that make a difference without necessarily doing the work to make the difference. And in some places and at some times, what that has looked like is people being told, you have motel vouchers, maybe only for 1 week, by the way, or even less than that. Go out and get these people to move. That is not a best practice, let's just say. That is not putting people on a path to stability. That is not even in some cases necessarily really making the best use of the resources that we have available. But it is physical motion that has in some cases meant that folks are, you know, not necessarily getting something that could actually be a better longer term solution, but that isn't as immediate. And also we want something better for people than a short-term hotel stay. And if I were outside tonight, I would want the fastest solution to not being outside. So I think making sure that you have more housing resources that are readily available to people is probably the #1 thing for the Housing and Essential Needs Program, rather than tapping into what is frankly sort of a politically generated short-term solution. You know, we'll take it for what it is, but that's not really what we're fighting for people. That's my, you know, opinion, and I recognize the pain of you as a service provider and of the people whom you are interacting with. And I want to see if Sarah wants to say something kind of on the policy level, both. Yeah.
Yeah, I mean, I have spent the bulk of my career trying to preserve and strengthen this particular program and iterations of this program, starting with, you know, when it used to be GAU, GAX, and then it was Disability Lifeline, and now it's Housing and Essential Needs. And, you know, we have over the years, we've made progress on policy changes with this program. We have preserved it from being eliminated many legislative sessions. We expanded the Housing and Essential Need voucher to those that are deemed to be longer term disabled and eligible for the aged, blind, or disabled cash assistance. It wasn't always available for that population. We've gotten, you know, this last session, a huge increase in the funding for this program. And I don't know exactly what is in store this session. It's a short session, so I don't think anything, you know, huge changes will be proposed, but this is, these programs, you know, I really have spent my career working on these programs, and they're I've seen the impact that they have, on people's lives, and another housing resource that's available to folks in our community where housing resources, where we simply don't have enough. So I don't know the answer on motel vouchers. I mean, I think that, particular programs potentially have them. I really don't know. I want to give Harold it looks like he's got his hand up too.
You don't have to. You don't have to give me more room. I take up enough space at times. Thank you, Allison, for asking if I had any updates. What we're doing at LEC is going into the next year. We're planning for the next year on our advocacy, and I think you, with the the political will and might that Stitch has brought for me in that bus ride. That first year I did, it was 5 years ago. It was eye-opening, and it just gave me more oomph to be more active in the community. So we're getting our political and our let's say council and government officials, how we're contacting them throughout the King County regional area, ready for next year. Making contacts, reinitiating some efforts that maybe fell through and we didn't follow up on, just getting our advocacy back and going. And we look forward to working with you and other people, and Aaron and the King County Regional Homeless Authority. They're everywhere I've gone this week, it seems like. I'm following them or they're following me. And Jan, it's unbelievable. But we're in good spaces with good people. So that's what I can say. And so I just thank you for calling on me there. And I wish I had more to say, but, just being me.
No, that's fabulous, Harold. Thank you so much. That is where you and I first met, is on the Advocacy Express bus, which left too early, but was a great ride. And honestly, Harold and Nicholas, the two of you together have just given me an idea that I'll float. Some folks may remember that Nicholas and Sarah and Jason Austin, who used to work at the coalition, and folks at Catholic Community Services, physicians, our friends at the Washington Low Income Housing Alliance, Representative Nicole Macri, changed the law to make sure that people who were receiving certain kind of benefits, short-term benefits, did not actually be made homeless once again in the transition to long-term disability benefits. And I wonder, it might be a really fun thing as we prepare for the next legislative session to give our, like the thing about the Advocacy Express bus is you could sleep on the bus. I confess I did, but you could also learn a lot and have a little mini workshop. And maybe we'll just invite folks to give some examples of what it has looked like to advocate at the state level. It's not like you change the law all the time. We don't always win. Sometimes it takes years, but the stories of when real people with real experiences, some of whom are on this call today, have helped to change the law are incredibly inspiring and powerful. And maybe that would be a fun way to kick off our advocacy together in 2022. And because Nancy Amade is on this call, I'm going to just peg her right now and say that we will do, with Nancy's permission, we'll find a way to do a little online homelessness advocacy 101 workshop and invite all of you.
Well, wonderful, folks. We are past our 10:30 ending time. Thank you for being here with us, hanging here with us till the very end. Please have a lovely, lovely rest of your Thursday. Have a lovely rest of the month. And we look forward to seeing you in December. So register and share that registration widely. Take care all. Bye-bye.
thank you for having us.
Thanks, Harold.
Thank you.
Thank you. Bye-bye.
Thanks, Nancy. Bye, Nadia.
I was wondering if I could ask a question before I sign off. I'm new, I'm not a member. I wrote in the chat that I'm studying clinical mental health counseling and just moved to Seattle. Anyway, so thank you so much for having me. A lot of this was over my head, but I took copious notes and am excited to join the December 16th meeting.